Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. It's an ancient disease. It's been mentioned in the medical books since the Greeks and the ancient Egyptians. It's a well-known disease to everybody, even though the knowledge of that disease might not be equal to all people. Some would think that it's a disease that would be caused by eating so much sugar, and others do have lots of information about the disease because either they have it or some of their relatives do have it, or they have read about it in books or internet. It's the diabetes. A big population does have diabetes with variable degrees of complications, and many of the patients of diabetes might not know that they do have diabetes until they start having serious problems out of it. With us today is Dr. Wael Yusri, consultant of gastroenterology. Welcome, Dr. Wael.
Hello.
Diabetes mellitus is one of the serious problems that the population does have, and apparently the percentage of the disease is increasing.
Yes.
Or is it the detection of the disease?
Actually, I want to start by defining what is diabetes, because there is a misconception about diabetes.
Yes.
Most of people think that diabetes is just a simple rise in the blood sugar, which is not actually the truth. There is many aspects of diabetes. It has many metabolic aspects and many organ affections and many associations. It's not just a simple rise in blood sugar.
So what is diabetes?
We can see this movie. I will explain to you the normal process and what happens in diabetic patients.
Yes,
Okay.
please.
This is the pancreas. It's a big gland in our abdomen. It's responsible for secretion of insulin, the key of the lock for use of glucose in our body. As we see, there must be insulin for the body to use glucose as a fuel. When we eat our food, the food is composed of fats, carbohydrates, and proteins. The carbohydrates, by the effect of chemicals in the stomach, they are broken down until they reach the final stage as simple sugars, which are the glucose.
Yes.
Okay. Then, by absorption, the glucose passes to bloodstream. Automatically, the pancreas starts to produce insulin. As I told you, it is the key for the lock.
Yes.
So as the body cells can take up the glucose, especially in the fat, muscles, and the liver. As we see here, the receptor, this is the bluish one on the surface of the cell.
Yes.
It will not open except when insulin is present, allowing these white particles, the glucose, to enter.
Yes.
This is the normal. But what about the abnormality, which
Yes.
is diabetes? Actually, you have two types of diabetes. There's type 1, in which there is complete destruction of the beta cells of the pancreas, which secretes the insulin. This usually happens in the childhood or early adolescence.
Yes.
Okay, this will lead to type 1 or juvenile diabetes.
Yes.
As we see here in the picture, there is no insulin, so glucose cannot enter the cells. Subsequently, there will be rise in glucose in the blood. You can see here the particles of sugars cannot enter the cell.
Yes.
The second type of diabetes is the type 2 diabetes, which happens especially in older age. The pancreas can secrete insulin, but the problem here is the insensitivity to the target cells to the insulin.
The target cells. What are the
Yes.
target cells?
As I told you, the fat cells and muscles and the liver.
Yes.
Okay, these are depending on insulin to take up the glucose.
So in type 1, we do not have the insulin itself.
Yes.
But in type 2, the cells are not able to respond to the stimulus of the insulin.
Yes. So pancreas automatically will secrete more. It will do more effort and produce more insulin to
Yes.
overcome this resistance. And finally, it will fade up and there will be no insulin to produce.
So that this might end up, the type 2 might end up to be a type 1 diabetes?
In its management, yes.
Yes.
At last, it will be like type 1.
So the destruction of the pancreas and the inability to produce insulin in type 1, how does this happen?
Usually this happens by some sort of inflammation following viral infections coming in childhood. This inflammation destroys the cells of the pancreas.
Yes. On the other side, the type 2, you said that it usually happens in the old age or the later age. So
Yes.
before that, the receptors in the cells were able to respond to the insulin.
Yes.
What makes them unable to do that later on?
There is some sort of genetic susceptibility to that,
Mhm.
and also other surrounding environmental factors, like obesity, for example, like bad habits of eating.
Yeah, so this takes us to the issue of there are people who are more susceptible, they're more at risk to get the diabetes. Who's more in risk to get diabetes?
These risk factors usually you have,
Mhm.
you can say, if a patient has a relative like brother, mother, or
Mhm.
father, or
Yes.
sister having diabetes, he is more prone to develop this type 2 diabetes.
Mhm.
Also, people who are sedentary, who are not doing any exercises or any activities.
Mhm.
Okay. Those who have other metabolic complications like hypertension, like dyslipidemia, they are also susceptible. A female who gave birth to a heavyweight child, for example, more than 4 kilograms, she is liable next few coming time to have diabetes.
The next pregnancies, you mean?
Yes, maybe.
Yes. So if somebody, I mean, many people do not know that they do have diabetes until they do have the complications. How do I know, or how do I expect myself to be a diabetic patient? What do I do?
First of all, as I told you, the risk factors you have to put in mind. If you have these risk factors,
Mhm.
you should be aware that you may develop diabetes at some time.
Mhm.
Second, there is symptoms that you can have an experience.
Yes.
It will lead to suspicion that there is diabetes. For example, you feel that you have thirst, fatigue, frequent micturition, especially at night.
Mhm.
There is weight loss. There is persistent sores, which is not healing rapidly as the normal individual.
This makes the person suspect that he might be
Yes, you have
uh,
to go directly to check.
to check to have the should we go to the doctor,
Yes.
not the lab, because many of the people would just go to the lab and do the check for the diabetes. Okay, my sugar level is okay, and then afterwards they come up to be really diabetic, and they're not, because they were in the early stages.
Mhm.
So this has to be emphasized, that they have to go to the doctor.
Of course, because many diseases have similar symptoms.
Yes.
So it's not just these symptoms for diabetes.
Okay, so what does the doctor do? What do you do when the patient comes to you, or some person comes to you suspecting that he has diabetes?
If I'm suspecting from his risk factors and from the symptoms he has that he has diabetes, I will start doing lab check for him. I
Mhm.
will do the fasting blood sugar and postprandial blood sugar. And with the values, we can see if it's diabetic range or not diabetic range.
Mhm. So when somebody comes to you in the early stages, maybe he's not diabetic. I mean, he's not in the high level of sugar.
Yes.
So if he do they have to do it repeatedly, more than one time, if they suspect that they have
Yes,
diabetes?
if he is in risk to have diabetes, he have to follow up
Mm-hmm.
and do frequent check for his blood sugar.
So is there a way to know that what we call the pre-diabetes, or the stage before getting diabetes, is there a way to know that I might develop diabetes, so that I would take care of myself
Yes,
afterwards?
if you, for example, see that the blood sugar is starting to get rise more than the normal level,
Mm-hmm.
but not yet reaching the diabetic range,
Mm-hmm.
you have to be cautious that in the soon you will have diabetes.
Mm-hmm.
So you have to change your lifestyle, the wrong habits you make.
And this diabetic, or the pre-diabetic patient, should he go to the doctor for maybe each year, each month? How frequent should they visit the doctor?
Actually, there is a new test. It's glycosylated hemoglobin.
Mm-hmm.
This give idea about the last 3 months.
Mm-hmm.
What about the metabolic profile as regards the blood sugar?
The glycosylated hemoglobin.
Yes, it's
So,
hemoglobin A1C.
so this is a routine investigation to be done for people who are suspecting the
It's
diabetes.
an available test. You can use either this, the hemoglobin A1C, or you can use the fasting and postprandial.
Mm-hmm. What do you get more from the glycosylated hemoglobin test?
In addition to diagnosis of diabetes, it gives you idea about the management you are giving to the patient. Is it correct going onto the right side or not?
Mm-hmm.
Because sometimes you make the fasting sugar, for example, today, it's normal, but over the 3 months, it may be disturbed. So this glycosylated hemoglobin shows us, is it over the 3 months, it was okay in the management or not?
Mm-hmm. So that would give you a prediction, some sort of prediction of what might be coming afterwards.
Yes.
So now that I know that I have diabetes, okay, does this necessarily mean that I will have to start medication, I have to start insulin? And this, I mean, when somebody gets to know that he does have diabetes, this is some sort of shocking, and then lots of questions jump into their mind. So we have to start with medication right away, or what do I do?
No, it depends whether you are type 1 or type 2.
Mm-hmm.
If you are young age, your child or adolescent, as I told you, this is type 1.
Mm-hmm.
There is no insulin in the body.
Yes.
So the replacement is essential. You have to take insulin.
Yes.
In addition to others, the diet control and exercise like that.
Yes.
But if you are type 2
Mm-hmm.
and you come early, diagnosed early with just simple small elevations of the blood sugar, we can start with lifestyle modification. You have to do regular exercise and you lose weight if you are obese, and you avoid other risk factors. For
Yes.
example, smoking. You have to, other than controlling your diet. But if this fails to control your blood sugar, we have to shift to the treatment.
Mm-hmm. So there'll be a very close monitoring. No need to start medications unless the sugar level, of course, is too high.
If
and
you present late
yes.
with high blood sugar, we have to start treatment.
All right.
Yes.
All right. So, brothers and sisters, we'll still be talking about diabetes after the break. So please don't go away. Inshallah, we'll be right back. Assalamu alaikum wa rahmatullah. Brothers and sisters, Assalamu alaikum wa rahmatullah, and welcome back to our episode about diabetes mellitus. Dr. Weil, we've been talking about now that the stage of the patient got to know that he does have diabetes, and lots of worries, of course, after getting to know this. What do I do? How do I get treatment? Do I get insulin? Do I get drugs? Do I, this is, of course, you
Yes.
see this lots of
First
things.
of all, the patient must not be worried a lot.
Mm-hmm.
He has to cope with diabetes like a friend, lifelong friend.
Yes.
Okay, but this friend, if you neglect, it will be a big enemy.
Uh-huh.
So, about treatment of diabetes, as I told you, there is first entity is to lifestyle modification, and the medications, and then the follow-up and the care.
So let's talk about the medication first. What kind of medication should a diabetic patient suspect or expect to be receiving?
For type 1 diabetes, unfortunately, the only available medication is insulin, because as I told you in the pathology of the diabetes, that there is no insulin in the body.
Yes.
So we have to give insulin from outside.
What kind of insulin? I mean, there are many kinds of insulin in the market, and patients would hear, you should take this, no, you should take this type.
This usually is left to the doctor decision, because he will see the level of blood sugar and will decide whether to take twice daily injections or multiple injections according to the blood level and the age of the patient. Especially for the children, it's difficult to control their diet, to give injections like that. So it will be the decision of the doctor to decide which insulin to be given.
How would a child like early teen, or maybe even earlier than that, and they should be able to monitor, I mean, the parents should be able to monitor the diet, and especially the injection thing. It's quite alarming for the parents. How do we get around this?
They have to convince the child that this is essential and this is his medicine to protect him from many problems. So by convincing the patient, he will get used to the injections. But actually this is very difficult in children, because you can't control his wills and his habits and like that.
Exactly, yes.
Yes.
And that's for the type 1, that we have to take insulin.
Yes.
And the adjustment of the dose has to be frequently monitored by the doctor. And
of course, it's better every diabetic patient, he has to get the small apparatus, the glucose check at home.
Yes.
So as to make frequent follow-up for the blood sugar, and whether there is complication happening or not, like low blood sugar or high blood sugar, he has to monitor with this apparatus.
Low blood sugar, because with insulin, this is very important. Some people might get an overdose of insulin,
Yes.
and they would go into a low sugar level in the blood.
Of course, he may pass to coma.
Yes, yes. How the patient or the person gets to know that he has or he's going through a low blood sugar level?
There are symptoms the patient will experience.
Mm-hmm.
He will have sweating, he will have near fainting, rapid heart beating, very fatigued, like that. He has directly to drink some sweet
Yes.
to raise the blood sugar and to monitor with the apparatus, as I told you.
Yes. This takes me to a frequently asked question by many of the diabetic patients. Should we start fasting in Ramadan, or should we not do the fasting in Ramadan? It's a debatable thing, and lots of people do have questions about it. When do we fast? When do we not fast or stop fasting in Ramadan for diabetic patients?
Unfortunately, it's not suitable for diabetic patient to fast because the medication you will take will be continuous action all over the day. While he is fasting, he is not taking glucose supply from outside. But some people, from a religious point of view, insist on fasting in Ramadan.
Yes.
In this condition, we start to give the medication before dawn.
Yes.
And also before breakfast.
Yes. And some of the patients who would have the levels controlled, they
sometimes
can do that.
They can resist this hypoglycemia, but I don't advise this.
So how about the type 2 diabetes? They don't have to take insulin, or
No.
they still have to take insulin?
At start, as I told you, if the blood sugar is not so high, he can make lifestyle change, and then we have to follow up the patient. If there is no good control for the blood sugar,
Yes.
we will give medication. And then we continue follow up. If the blood sugar is not controlled, we will shift at last to insulin.
So eventually they have to go through insulin?
Some patients.
I mean,
like
there are people who would not need to have insulin all their lives and just maintain on the
yes, many people are
medications.
controlled with just lifestyle change, diet, and the oral tablets.
Yes. So the other side of the medication, or the treatment of diabetes, is the lifestyle, as you said.
Yes.
What lifestyle does the diabetic patient have to do? What kind of food that he has to eat or not to eat? What drinks? This is really causing some discomfort to many people.
Of course, they have to be cautious with carbohydrates. Carbohydrates are the essential source of glucose.
Yes.
So these carbohydrates are available in the rice, in the bread, in the pasta, juices. All these have to be avoided.
Avoided, meaning to stop eating them?
Actually, this will not happen. You can't tell the patient you will not eat rice, you will not eat bread, you will not eat pasta.
Yes.
You have to reduce the amount. And on the other side, you increase the intake of vegetables, for example. Some fruits also are better avoided, like grapes, like dates, sugar cane.
Yes.
Okay. Other fruits you can take, but just small amounts.
Yes. Some people would say honey, the bee honey is considered to be, as we know, a remedy or a cure for many of the diseases. So honey and diabetes, people would insist, no, it is a medication or it is a remedy, and we know that, so they insist to take it. Honey and diabetes, this is another
Yes,
bumpy
of course.
question for the...
Many ask about this.
Yes.
Yes. Actually, honey is composed of 75 to 80% of sugars. They are divided as fructose, which is 35 to 40% sugar,
Yes.
and the glucose, which is 30%, and maltose, which is 3%. This changes, the concentration of each changes from a part of the year to another part. For example, in summer, the bees will breed on the flowers. This will get mainly the fructose component, which is not harmful to diabetic. But in winter honey, they breed on the fruit, like grapes.
Yes.
So this will be full of glucose. So this will be harmful. And studies say that taking small amount of honey for type 2 diabetes, because type 1 is forbidden to take honey. The type 2 diabetics, when they take small amount of honey, this will stimulate the pancreas to produce more insulin.
Really?
Yes. But this must be under supervision of the physician.
Mm-hmm.
Because
not be
sometimes you
taken,
have
yes.
blood sugar high, you can't even take this small amount.
Exactly, yes.
Mhm.
Earlier you said you should treat the diabetes as your friend, or
Mhm.
else, if you just neglect it, it would be your enemy.
Yes.
What complications and problems that might show up from diabetes to long-standing, especially long-standing patients that we see having lots of problems coming up because of the negligence of the diabetes? What are the complications, the common complications that we might face?
As I told you from the start, the misconcept about diabetes, it's not just the simple rise of blood sugar.
Mm-hmm.
Diabetes affect many organs in the body. For example, the kidneys, the nerves, the blood vessels, even the skin. Okay, and also there are dangerous association with diabetes. The disturbance in lipid profile, the hypertension, all this have to be monitored all together
Mm-hmm.
and have to take care of each of them.
Mm-hmm.
As I will show you in these photos,
Mm-hmm.
this first photo is showing a skin lesion that occurs early in when there is insulin insensitivity, which is the start of the diabetes type 2. This is
Mm-hmm.
called acanthosis nigricans. It's blackish velvet-like skin lesion, which you can see here, especially in the nape of the patient and in the armpit.
Yes.
When we see this lesion, we suspect that this patient is early will have diabetes.
Mm-hmm. So this is an early sign of diabetes.
Of insulin hypersensitivity, which will progress to diabetes.
Yes.
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 This is one of the complications of diabetes.
Mm-hmm.
This is periodontal disease or gum disease, which will happen in diabetic patients. They usually suffer from looseness of the teeth and in
yes.
the problems with the gums.
Mm-hmm. There's quite an inflammation around the
Yes.
teeth.
Yes, and you can see also hemorrhages in the gum.
Yes, there is some bleeding. Yes, exactly. Yes. What else?
This is another skin finding which we usually find in diabetic patients. It's called necrobiosis lipoidica, diabetic aurum. This is just a bluish discoloration
Mm-hmm.
in the skin. It's not harmful, but its appearance is not convenient to the patient to have like that.
Yes, so some would consider it as a complication. Yes, of course.
Now we shift to the major complications.
Yes.
As you see this diabetic foot, it
Yeah.
shows ulcers in the foot.
Mm-hmm.
Why ulcers happens to these diabetic patients?
Yes.
Because usually they have vasculature affection, the blood vessels and the blood supply to these terminal parts of the body in the foot and toes.
Mm-hmm.
No sufficient blood supply, and the sensation is also affected and diminished. So when there is minor trauma, the patient will not recognize that there is trauma, and it will proceed and worsen with time, and even he will not notice.
It's very common to see the patients with diabetic foot. How do we advise them to get away from this? Besides, of course, controlling the diabetes itself. I mean, what care should they give to their feet to prevent these
Yes.
complications?
He must examine his foot every day, and
Mhm.
if his vision is affected, a close relative must check his feet,
Mm-hmm.
because as I told you, he may not recognize that he has lesion in his feet.
Because of the less sensitivity of the nerves
Yes.
and inability to feel the pain as
Of
in
course.
normal cases.
Yes, yes.
Yes.
So when we have this problem, we have to treat it surgically and with dressing and with control of blood sugar.
Yes.
This is another complication. This is the normal fundus on the right side. The fundus is the posterior part of the eyeball,
Mm-hmm.
which contains the retina, that contains the receptor and the terminal nerve endings. This is affected in diabetics. As you see on this slide, there is hemorrhages, and this is new vasculature and the hemorrhages and exudates in the retina.
Yes.
All this cause diminution of the vision of the patient.
Oh.
For diabetic patient, he has to check his fundus every year.
Every year.
Yes, in order to detect early these lesions.
Yes.
And
This
many
might
modalities
lead
now.
to a retinal, what we call retinal detachment and inability
Sometimes
to
in the late stages.
the late
yes.
stages,
Yes,
so.
yes.
and it's manageable if we just monitor it every year. The eye doctor
Yes,
might be
by
able to
laser photocoagulation of these lesions.
exactly.
Yes.
Yes. So to sum up, or not to go through this complications, what do we have to do as a follow-up for a diabetic patient?
Yeah, the patient has to follow up his blood sugar to see whether it's controlled by what he's doing
Mm-hmm.
or not.
Mhm.
He has to do the fasting and postprandial blood sugar,
Mhm.
and it's better to have daily check with his apparatus at home.
Yes.
Every 3 months, he make the glycosylated hemoglobin, which, as I told you, give idea about the management. It's going properly or not.
Yes.
He has to search for other associations like the lipid profile,
Mhm.
like the kidney affection,
Mhm.
and to control the blood pressure.
Yes.
If you
Dr.
do this,
Yes.
you will, it will be your friend, not your enemy.
That's very good. Dr. Wael Yusri, thank you very much for being with us here today and giving us so much information about diabetes. Brothers and sisters, we've enjoyed having you with us today. Please do not forget to write to us. Our email is health@huda.tv and our website is huda.tv. Thank you very much. Inshallah, we'll be seeing you in the next episode. Till then, Assalamu alaikum wa rahmatullahi wa barakatuh.